Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Why do you still wake up stiff and aching even after dutifully swallowing pain pills, attending physical therapy, and contemplating surgery? If you feel trapped in a costly cycle that never solves the hurt, this episode speaks directly to you. Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, here to unravel the hidden reasons your pain lingers.
I'm Alara Sky. Chronic spinal pain alone drains more than $134 billion each year in the U.S., yet millions remain stuck. Today you'll learn how weak ligaments, tight muscles, misalignments, trapped emotions, and simmering inflammation quietly drive that misery, while mainstream interventions often miss the mark.
Let's ground this. Most joint or spinal pain starts with overlooked structural issues. Tight iliopsoas or quadratus lumborum muscles can yank your lumbar spine forward, while lax ligaments let vertebrae slide and irritate nerves. If one leg is even a few millimeters shorter, your pelvis tilts, the spine compensates, and pain escalates.
Those tense muscles rarely get the focused stretching they need. Physical therapy routines emphasize strengthening, yet without releasing chronic tightness, added strength just locks faulty mechanics in place. Correcting leg length differences with a simple heel lift and restoring natural curves can lighten the load on discs and nerves.
Disc herniations draw dramatic attention, but they're often effects, not causes. When a flattened lower back curve pushes discs backward, nerves compress. Unless you revive ligament strength and posture, focusing only on the disc resembles patching a tire while ignoring the nail that punctured it.
Structural fixes matter, but pain also flares when unresolved trauma keeps your fight-or-flight system on high alert. Trapped emotions, mold exposure, Lyme disease, and even surgical scars can amplify nerve signaling. An overactive sympathetic nervous system makes light pressure feel like fire, so calming that circuitry is vital. The first clinical move is almost always medication. NSAIDs, acetaminophen, gabapentin, steroids, and, historically, opioids. When those disappoint, steroid injections follow, then a last resort surgery. Each rung is sold as progress, but many of you end up deeper in pain and burdened by side effects.
Start with NSAIDs. They dull discomfort partly, so users often exceed safe doses. These drugs top U.S. charts for drug-related hospital admissions, driving heart attacks, strokes, kidney failure, and fatal gut bleeds. One review found kidney disease risk rose up to 212% among chronic NSAID users.
Gastrointestinal bleeding killed more than 16,000 Americans in a single year, and tiny bowel injuries emerge in over half of long-term users. Worse, NSAIDs slow ligament healing, meaning the very tissue that stabilizes your spine recovers sluggishly, setting you up for repeat injuries. Yet prescriptions keep flowing.
When NSAIDs underwhelm, you reach for acetaminophen. It looks gentler, yet 56,000 emergency visits and 500 deaths a year trace back to liver failure from acetaminophen overuse. Another hidden cost: knocking down fevers can blunt your immune defense, prolonging illnesses you're trying to defeat.
Next comes gabapentin, or its cousin pregabalin. These drugs shine in specific neuropathic pain, but do little for common mechanical spine pain. Many users trade discomfort for drowsiness, dizziness, and cognitive fog, plus the rare but severe risk of breathing suppression at higher doses.
Corticosteroids arrive with fanfare, quick relief that exacts a steep price. Regular use strips up to 15% of bone each year, doubles fracture risk, weakens collagen, spikes blood sugar, and raises heart attack, heart failure, and stroke rates. Temporary comfort often leads to brittle bones and surgical consults.
Studies show vertebral fractures strike 37% of long-term steroid users, and high doses increase risk fivefold. Avascular necrosis, bone death from lost blood supply, hits nearly 7%. Patients seldom hear these numbers before agreeing to repeat injections or extended oral courses.
Cue the surgery funnel. Spinal procedures can net a hospital well over $100,000 per case, making them the most profitable elective surgeries. Yet, failed back surgery syndrome haunts 10 to 40% of recipients, leaving nerve damage or enduring pain that no scalpel can undo.
Investigations have spotlighted surgeons who ran multiple operating rooms at once, pumping revenue while complications mounted. Hospitals shielded them because their profit margins soared. For you, that can mean aggressive procedures offered before safer options are fully explored.
The opioid era illustrates what happens when profit eclipses prudence. Purdue Pharma paid an FDA reviewer to claim OxyContin wasn't addictive, then marketed it relentlessly, while the American Pain Society pushed pain as the fifth vital sign. Brief prescriptions sparked lifelong addictions, and tighter rules now leave many desperate patients without effective relief.
With opioids restricted and mainstream fixes faltering, you need alternatives that address root causes without collateral damage. One highlighted in the article is DMSO, dimethyl sulfoxide, a naturally derived compound with multi-layered benefits.
DMSO increases microcirculation, tamps down inflammation, relaxes muscles, and blocks pain signals while supporting tissue repair. In studies of patients with lumbar disc herniations, recovery times were cut in half. Unlike NSAIDs or steroids, DMSO enhances healing rather than hampering it.
Thousands of reader testimonials echo those findings. Rapid relief from bursitis, arthritis, complex regional pain syndrome, and post-surgical discomfort when standard drugs failed. Professional athletes in the 1960s and 70s used DMSO to sprint back from injury, but widespread awareness faded as patent-protected drugs crowded the spotlight.
Compared with NSAIDs, DMSO offers sharper, longer-lasting pain reduction without gut, heart, or kidney fallout. Compared with steroids, it supports collagen integrity instead of eroding it. For sprains, disc pain, or arthritic flare-ups, this single agent can replace multiple risky prescriptions.
Still, no topical or oral remedy replaces foundational work. Address tight hip flexors with daily stretching, correct leg length imbalances, strengthen lax ligaments through targeted exercise and nutrient support, and calm sympathetic overdrive with breathwork or trauma release techniques. Each root addressed shrinks the pain loop.
Here's your challenge. Pick one root factor, maybe reallocating 10 minutes to stretch stubborn hip muscles, scheduling a posture evaluation, or replacing nightly NSAID tablets with a guided DMSO protocol, and act on it within the next 24 hours. Track how your pain and mobility respond over the coming week.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.